Welcome to our Antenatal Education Class. The following short videos and slides will help answer some of the questions you may have about the changes that happen to your body in pregnancy, the labour stages and pain relief, and what happens once the baby is born. This information will assist you to make birth choices in your birth plan. This generally happens around 34 to 36 weeks. Please speak to your community midwife for further details.
I'm Carolyn Lindsay. I'm one of the specialist physios in women's health, and today we're going to go through some exercises that can help your body to sort of adjust to the changes of pregnancy and also to try and prevent the onset of any back or pelvic girdle pain. So the first thing that we're going to think about standing posture and how that can have an impact on the development of symptoms and problems. So taking a look here at Lisa and how you're standing. So the first things that I notice are that your knees are quite locked out and straightened, and there's a bit of an arch here in your back. Your pelvis is tilted forward a little bit. So this can be associated with having the development of back pain because it puts your back joints under a little bit more strain. So in order to try and correct this, what I'd like you to try and do is not to completely loosen your knees, but just have your knees a little bit soft so they're not totally locked out. And then start to think about where you've got your weight. So does it feel like your weight's really far forward? Do you feel like your weight's really far back on your heels? Try and get a little bit of weight through your heels and then a bit of weight through the base of your big toe and the base of your little toe. And then you're thinking about getting some length up through your spine, so keeping your chin just soft, so don't lift from your chin, that's it. And think about just almost as though you're going to push my hand away with your head. So you're going to push down through your heels and get tall up through the top of my head. And what you feel then is you can feel that your abdominal muscles are just kicking in a little bit there. So if you go back into the posture that you were happy in, can you feel the difference there with your tummy? And then you're going to just slightly unlock your knees. Think about dipping your chin a bit, pushing up through here, down through your heels, and you can feel that already those muscles that we want to get working can kick in a little bit. So then thinking about the other type of posture that people might be in, so if you could just demonstrate for me, so a bit of a chin poke posture and hanging a bit on the hips. So this is the other posture that people will tend to adopt, where they hang on their hips and the head's a little bit forward, and this can be very associated with developing pelvic girdle pain. So again, all you need to do is try and again bring your pelvis back in line with your feet and think about your weight through your heels, base of your big toe, base of your little toe, and then chin soft, and you're gently stretching up again, thinking about elongating your spine. And as shown here, this needs to be quite a relaxed way of correcting, so you don't want to be holding everything really tight from your thoracic. And then those types of keeping on correcting your posture little and often can help kick in the muscles that we want to work and stop the development of problems later. Now we're going to have a little look at sitting posture and how that can make a difference as well. So looking here at Lisa's natural sitting posture, this is very common with most pregnant ladies and most of us in fact, that we tend to slump under here with the pelvis and then be quite rounded through here, and then with the chin and the head poking forward. So that actually puts quite a lot of strain onto your muscles here from having to hold your heavy head forwards, and also some strain on your lower back, and it's a more difficult position for moving out of for your pelvis as well. So to correct that, you're going to just gently think about your weight through your sit bones and think about pushing down there and gently coming up and forward. And it's very similar to correcting your standing posture, where you're keeping your chin a little bit soft and thinking about just getting up tall, pushing down through your sit bones and through the top of your head. So this should be quite a relaxed posture. You should still be able to move a little bit. You don't feel like you're bracing really hard with your thoracic, and it should feel fairly easy. But it's going to be difficult to maintain that posture, so you'll probably need to keep practicing little and often. So the other way that people can sit to sort of overcorrect when they're pregnant is to tilt the pelvis quite far forward. And again, you can see this puts quite a bit of strain across this area of your back here. So again, you're thinking about the pushing down through the sit bones and the top of your head and just coming up tall and then into that nice sitting posture. So then if we think about sit to stand, it's very common if you go back into your posture there and then have a stand up for us. And you can see that as Lisa stands up there, she locks her knees out and she's sort of standing back into that arch posture. So if you come and sit back down again, that's grand, thank you. And then this time you're going to think about keeping your chest up. So think about this part of your chest staying up and forward, and you're going to lean forwards and come up and not lock your knees out and stand up there. That's it, so a bit more actively. Okay, so that's a simple thing, but just a way that you can start to change your movement patterns and keep practicing that, and then that can make a difference and help your body to adapt a bit better. Looking at the gym ball here, a gym ball can be a really good thing to do some exercises on. If you're looking to buy one, then you want to get one where when you're sat on it and it's properly pumped up, your hips are slightly higher than your knees. You don't want your hips kind of level with your knees or lower than your knees, because that makes it awkward. So sitting on the ball, you can see that just sitting on the ball immediately starts to engage your muscles a little bit and improve your posture. And then there's a few exercises that you can do nicely on a ball to help with control around this area and also easing off any stiffness in your lower back. So very gently doing some pelvic tilts where you're going to tilt your pelvis gently forwards and then tilt all the way back and then back up forwards nice and gently. So you're not exaggerating the forwards movement too much, and you're thinking about control and gentle slow movement, and then you can feel that it kind of targets your core muscles here. That's lovely. So then the next one, thinking about doing a little bit of tilting side to side. So you're going to just tilt one side and then back over to the other side nice and slowly, and back over to the other side, okay, and back to the middle. That's it, lovely. And then this is also a good position where you can do your pelvic floor exercises as well. So doing your gentle lift up inside, which we've talked about in a different section. As your pregnancy progresses, your abdominal muscles are working very hard and stretching and lengthening. So it's very important to try and work these muscles as well as your pelvic floor. And a good position to do this in is on your hands and knees, if that's comfortable for you. So thinking about your position here, if you can bring your hands back a little bit just so that they're under your shoulders there, and you've got your knees under your hips, and then not too relaxed through here, so not like a saggy donkey, but just a little bit of straightness through here, and again just looking ahead of you there on the mat. So then, without letting your back sag, let your tummy just release and relax a little bit, and then you're thinking about drawing in with your pelvic floor muscles and a little bit as if you're trying to get your belly button back towards your spine, and still breathe normally and try and hold that for a few breaths, and then release down. Have a little rest, and then again, so looking just ahead of you there, so your head's not holding up. You're going to gently, as you breathe out, draw in with those muscles and try and hold for a few breaths. That's lovely, and back down. So you'd be trying to do 10 of these, and you're aiming to hold for 10 seconds and do 10 of them, but for most people, holding for a couple of breaths and trying to do 10 of them to start with is more than enough. If your hands get uncomfortable in this position, you can make fists and actually go onto your fists, and that can be a little bit more comfortable. Or if that's a problem, you can also go onto a gym ball and lean forward over a ball to work this. But this is also a nice position to do a little bit of humping and hollowing to try and ease your lower back off and your middle back if you've got any strain there. So just humping up, hollowing down a little bit, and then back up again. And you can tuck your head under when you're doing that bit, that's lovely, and back down. The other position that can be quite nice is especially if it's uncomfortable in that hands and knees position, is forward lean over a ball. And this is a nice position to relax in as well. But then in this position, you can also do your gentle draws in with your pelvic floor and your tummy. So trying to draw that in without moving your back too much, and hold for a few seconds and ease off. You can also do some tilting of tucking your bottom under you and tilting back the other way. And it's also quite a nice position to just do some general rocking around and movements to ease things off a little bit. These are some exercises that can help with rib flare and with any discomfort that you're getting in your middle back, and also with all of the changes that are happening related to the breast changes as well, where you can get some stiffness and discomfort in that middle back area. So thinking about doing some gentle rotations of your middle back, so with your arms gently crossed across your chest, and then you're just going to twist around to one way, back to the middle, and then back to the other way. So just nice and gently, not pushing into any pain, but just getting a little bit of movement there and back the other way. So you probably do about 5 or 10 of these at a time. Thank you. So then you're thinking about giving a bit more space for if you're getting any rib pain or rib flare, where you're going to think about lifting up and over with one arm. So keep your other arm down on the chair or just down beside you, and you're thinking about lifting up and over towards the opposite part of the ceiling. So you're lifting up and over to really elongate and stretch out down this side. So if you're doing it wrong, then you'll be more just crunching down, and you can see that there's not as much stretch here and it's a lot more compressed down this side. So again, thinking about lifting up and over towards the opposite ceiling of the wall just to give a good stretch down here. And again, you're looking at doing 5 to 10 of them just within your own tolerance. This exercise is a nice one to work your deep buttock muscles. So these are the muscles that keep your pelvis nice and level when you're walking or if you're standing on one leg. So if the muscles were weak, for example, and I stand on one leg, then your pelvis will tend to tip to one side. So obviously that's not as good for walking, and it can lead to the development of pain. If you come into side lying on a bed, and you've got a pillow in between your knees for comfort, trying to keep your back nice and straight. Keep your heels together, your top hip slightly rolled forward, and then all you're going to do is gently lift your top knee, but without rolling back. So if you lift and roll back, you can see that Lisa's pelvis comes all the way back here, and then the right muscles aren't working. So you're trying to keep that hip forward and just gently lift a small way. Try and hold for a few seconds, back down, rest for a few seconds, and then repeat. So you're trying to do this, aiming for 10 times if you can. It can get a little bit uncomfortable into that buttock muscle, so you might want to start with only a few at a time and aiming to do 1 set every day if you can. One of the difficult things is getting comfortable at night. So especially if you've got any back or pelvic pain, it can really help to get some extra pillows into the bed and support in between your legs. But the important thing to think about with this is, if you can have your knees as bent up as your bump allows, that's actually more comfortable and takes some pressure off your pelvis. And also to use enough pillows so that actually your hip, your knee and your ankle are roughly parallel, rather than your knee being dropped forward. This can be more comfortable. And if you're a little bit further along and it helps as well, then a bit of support under your bump from a very thin towel or cushion can help. Another difficulty is getting out of bed. So Lisa gets up very similarly to how most pregnant ladies get out of bed, which is obviously quite difficult because your tummy muscles are stretched and not kicking in as much. They're not as efficient, and this is quite a straining way to get out of bed. So a way that can make things a bit easier are if you've been lying still for quite a long time, actually doing a few pelvic tilts to just get your body moving a little bit, a few gentle pelvic floor squeezes to just wake things up. And then if you can shuffle a little bit more towards the edge of the bed, and then you're actually going to use the cantilever of your legs coming off and your body pushing up. So bring your knees both together up here, and then as your legs come down, you're pushing up, and then it's just a lot easier and a lot less strain on your body. Around 1 in 3 women have bladder problems in pregnancy. Your pelvic floor muscles can really help with this. They're the muscles that span the bottom of your pelvis, so they go from your pubic bone at the front to your tailbone at the back, and they're also what's supporting your inner organs, so your bladder, your bowels, your uterus, and also supporting the weight of your growing baby through the pregnancy. So it's really important that these muscles are strengthened up. There's an outer layer of muscles and then an inner, deeper layer of muscles, which are the ones that we're concerned with. So these muscles are called your levator ani muscles, which means pick up your anus, which gives a good clue as to how we're going to be working these muscles. And in fact, if you've ever seen a dog being told off and its tail goes up between its legs, that's because the pelvic floor's gone tight and those muscles are working. So trying to do these exercises, you can do them in sitting, lying, side lying. They're the best positions to start in. And so if you sat here in a nice posture with your feet flat on the floor, thinking about being in that nice upright posture, and then to work the muscles, you're thinking about where they are. So from your pubic bone to your tailbone, and as you squeeze those muscles, they're going to lift up and forwards. But it's a very gentle movement. So you're thinking about very gently pulling in from your back passage as if you're trying to stop wind. So you're trying to just gently clench and lift up and forward, and then think about drawing in more towards the front as if you're trying to hold in wee. But with all of that, you're trying to still keep breathing normally. So you don't want to be overusing any of the other muscles. So common things that you might notice are that you're squeezing quite hard with your buttocks, or you're holding quite tight around here. So relaxing everything else and just trying to think about that gentle lift up and in, only so much as you can keep breathing normally. And you might feel it in your lower tummy, but you shouldn't be feeling it any higher up. And everything's quite relaxed in your shoulders as well. So you're aiming to do repetitions of 10, so 10 of however many seconds you can hold. So to start with, that might only be a few breaths, it might only be 5 seconds holding, but it's important to do 10 of them, and then gradually build up to try and do 10-second holds and 10 of them. But you need to be aiming for 3 sets a day, so it's quite difficult to try and fit them in, but the regularity of it to try and work the muscles as much as you can. So then, as well as the slow ones, which are going to help build up the endurance of your muscles so that things will support more, you also want to be doing some quick contractions so that your muscle can kick in if you need them, if you're coughing or sneezing or doing something quickly. So for these, you're trying to pull in and release as quickly as you can, but ideally just feeling this again, low down, everything's not happening here. So you're just going to pull in as much as you can without working your upper tummy too much. If you've been trying these exercises regularly for about 4 to 6 weeks and you're still finding it really difficult, or you're not seeing any progress, then it's worth asking your midwife or your health visitor if they can refer you, or your GP, to come and see physio so that we can assess you and give you a hand with this, because these exercises are really, really important, not just for pregnancy but throughout the rest of our lives as well. We're going to think about areas where we hold tension, and also some strategies to use breathing to help with relaxation and also through labour. Thinking about areas where we might hold tension, we might find that our shoulders are going up tight and raised, might be clenching the hands into fists, the jaw might be quite tight, or might be noticing that the pelvic floor is squeezed up tight, or the tummy. So it's worth just looking at your own body and thinking about what the reactions are if you become stressed or anxious now, before labour, so that you can watch out for some of those things. One way that's really good to think about is your breathing. So for nice relaxed breathing, if we think about the diaphragm, that's a dome-shaped muscle, sort of here. As you breathe in, your diaphragm moves down and flattens, and your tummy will gently rise as air comes in. And then as you breathe out, the opposite happens. Your diaphragm's moving back up, the air's going out, and your tummy's gently flattening. Now obviously in pregnancy there's a lot more space taken up by the baby, and it does become more difficult to do this nice relaxed breathing, so it's good to start practicing this. So if you pop a hand just gently on your lower tummy there, and you're just focusing on your breathing in this area. So just nice relaxed breathing. As you breathe in, your tummy gently rises, and as you breathe out, your tummy gently falls. So there's not too much movement happening up here with a big breath, and you've just got the gentle movement of your tummy. So in the first stage of labour, in the early stages, that's really nice to start doing that nice relaxed breathing. And you can also get your partner to do a little bit of massage as well. So either just with the hands across this area, or you can use maybe a tennis ball or a little massage ball and roll it around to sort of help ease the muscles off here. And it's also a nice time to do some of that pelvic tilting and moving around. And then in labour as well, some women quite like a bit of gentle massage to this area. So you're just kind of going with what your partner likes and needs at the time. Annie's just joined us now, and we're going to talk through some breathing and relaxation through labour. So thinking about that late first stage of labour.
We just wanted to illustrate how very often women will breathe when they're in pain. They tend to tense up, they will clench their fists quite tight, and there'll be a lot of tension here. If you're breathing in this way, it's quite difficult for the neck of the womb to relax and open around the baby's head. So really, if you breathe nice and slowly, like Caroline is going to show you in a moment, you will be aiding your baby's journey through the birth canal.
So, as we're saying, with that fast, rapid, shallow breathing, that tends to make everything a lot more tense. So do a nice deep breath out slowly. So sigh your breath out slowly, and then relax your fists, and you're thinking about just that gentle breathing where your tummy is gently rising and falling. So as the surge of the contraction carries on, trying to do that nice relaxed breathing, and then towards the end of the contraction again, doing another sighing out slowly breath. So nice breath to sigh out slowly. And at any point through your labour, if you're feeling that tension building up and your breathing's becoming rapid and shallow, do this SOS breathing, or the sighing out slowly breathing, because that slow sigh out can help to relax and release. And then your partner's also looking for any areas where you might be holding any tension. So you can use this type of breathing through the second stage of labour as your baby's making its way down the birth canal, and just thinking about where you might be holding tension. So is your pelvic floor actually clenched really tight? Because obviously this needs to be released and relaxed. So trying to focus on letting tension go out of your shoulders, out of your hands, and letting your pelvic floor gently release. We've talked about areas where you hold tension, and now we're going to move on to other ways that you can help to relax these areas. So by tensing your muscles and then releasing and relaxing into a new position. So if we're thinking about your face and your jaw, if there's tension held there, so actually to try and release your jaw and open your jaw, but without opening your mouth, to give that a good stretch downwards, and then allow that to stop and just feel the new position of your jaw. So then you're going to again think about opening and stretching your jaw, but still keeping your mouth closed. Stop and feel that new position, and then you should feel that your things are feeling a little bit more released and relaxed. Think about the position of your tongue in your mouth. Does it feel like it's held right up against the roof of your mouth? Can you allow it to just come down into the middle of your mouth? So then if you're thinking around your shoulders, do these shoulder muscles feel quite tense and tight? So in whichever position you're relaxing in, think about drawing those shoulders down. So you're thinking about pulling your shoulders down a little bit and holding, and then release, and feel the new position of your shoulders. So you're going to do that twice, and then moving around to think about your breathing again. So just that gentle, relaxed breathing, that as you breathe in, your tummy's gently rising, and as you breathe out, your tummy's gently relaxing back. So just to focus on that nice, slow, relaxed breath. Then if Lisa's going into a contraction or having a surge, you can see that her fists and her face are really clenched up and tight. So thinking about doing the opposite with the fingers. So really stretching your fingers out there, Lisa. Really stretch them hard out the other way, and then stop and let them just relax down. So you can do that a couple of times. Stretch your fingers out again really hard, and then stop and let them just relax onto the surface that they're on. And similarly, just trying to relax the lines on your face and ease your face back the other way, and then let it just relax down again. So become aware of where the ball is, where the ball's supporting your arms, supporting your hands, and then again bringing your attention back to your breath and to that nice gentle breathing, or if you need to doing one of the long slow sighs out. In a straightforward pregnancy, moderate regular exercise is good for you and the baby. If you have any medical conditions such as heart or breathing problems, poorly controlled diabetes, high or low blood pressure, or a low-lying placenta after 26 weeks, then you need to seek advice from your doctor before starting any exercise programme. The aim is to maintain or slightly improve your fitness by carrying out a moderate level of exercise to improve your cardiovascular fitness. Moderate exercise is where you could still carry on a conversation whilst exercising. The aim is that you're working up to the recommended level of 30 minutes of exercise 3 times a week. Gentle exercise is safe throughout pregnancy, but if you haven't exercised before, it's advisable to wait until after 13 weeks. If you already exercise regularly, you're fine to carry on. There are physical and psychological benefits of exercising, including maintaining your fitness, helping with healthy weight gain throughout your pregnancy, and improving balance, coordination and endurance. And it also helps you to be fit for your labour. The best types of activities are low-impact activities such as walking, swimming or aqua aerobics, Pilates or yoga, and non-contact sports without a risk of falling. There are local antenatal and postnatal activities run from both the Healthy Living Centre at Staveley and Queen's Park Leisure Centre. Things to be aware of are that your joints are slightly more lax, and where your centre of gravity is altered by your bump. So this makes it slightly more likely that you might go over on an ankle or lose your balance slightly. However, this is still very unlikely to happen, but just to be aware of. It's also important to keep hydrated whilst exercising and not to exercise to the point of fatigue when you're pregnant. From around 16 weeks, you need to avoid lying flat for any prolonged activity during exercise, because this can make you feel faint and unwell. Stop exercising and seek advice from your midwife or doctor if any of the following happen when you're exercising: any leaking of amniotic fluid, severe abdominal pain, vaginal bleeding, shortness of breath, dizziness or palpitations, or any severe calf pain or headache, or if you notice that your fetal movements or the movements of the baby are reduced or absent. If you're unsure about exercising in pregnancy or which types of exercise are suitable for you, then your midwife or doctor can refer you through to physiotherapy for an assessment.